Hello and welcome to this short video on how to advise a patient on wearing and cleaning their dentures. So the oral hygiene routine of denture wearers is equally as important, if not more important, to ensure the patient has the right information and are confident undertaking their oral hygiene routine when wearing dentures, because a lot of people historically have thought that they don't need to look after their denture in terms of oral hygiene routine, cleaning their denture, the same way that they would have to look after their teeth. However, as we know, plaque will be in the mouth, and as it grows and develops, it will attach itself to oral devices such as dentures, removable appliances, fixed appliance, anything that's in the mouth, rather than just teeth. It's not just a tooth issue, because plaque is developed in the mouth by the debris and the bacteria and the microorganisms that we have in the mouth. So we're going to look at how we would advise a patient on how to wear their denture and look after their denture, and also how to clean their denture, as and when that's and the sort of the times that that's required to happen. So unfortunately, I don't have a denture at home, but I do have this mandible from my anatomy skull, so I'm going to be using this today. So an important thing when we're looking at how a patient wears their dentures, and most importantly, when they should not be wearing their dentures, because a lot of patients do believe that once their denture is in, it should just remain in the mouth sort of permanently, and they shouldn't really take it out for anything. So it's important that we advise them in the dental practice the times when they should be wearing it and when they shouldn't be wearing it. If it's a brand new denture, you may find the dentist asking the patient to practice speaking with their denture in place. And this is just to allow them to get used to having the denture in place and allowing their soft tissues in their mouth to adapt to having that new device in there. Some patients will have a lisp temporarily or find it really difficult to speak as they're adjusting to having their new denture in place. Simple activities such as reading a newspaper aloud, practicing the alphabet, practicing saying the days of the week. These are all really good and easy tasks that a patient can do to get used to their new denture. So we've mentioned that a patient should wear their denture as advised by the dentist, and they should try to persevere with their new denture in the beginning, because there will be a degree of tenderness. And we do find that because of that tenderness and because of that pain, a patient will remove their denture and not be wearing it. It is typical for a denture to cause some discomfort and tenderness to the soft tissues, because it is a new device and the mouth is getting used to having this device in place or in situ. So it is important that we let the patient know that tenderness is to be expected, and this should die down probably after around 5 days. If it is still very sore, very tender, then we should ask them to contact the practice so that we can get them to come in and we can have a look to see if there's any adjustments that are needed and required. It is really important, if a patient is coming in to the practice because of an issue with their denture, that we advise them to wear it for at least an hour before they come into the practice. This might seem a bit cruel because obviously they've just wanted us to tell us that it is very sore, but if they do manage to wear it for at least an hour, it actually allows us to see where the tenderness is happening, because we will see that soreness on the gums. So it's sort of like a little bit of a cruel to be kind method, because it will allow us to sort of see exactly where on the denture needs to be adjusted to help get rid of that painful spot in the mouth. Patients should wear their denture consistently throughout the day, and they should be advised that they would be using their denture, they would keep their denture in their mouth to eat and drink and speak as normal. So we want to encourage them to have their denture a permanent feature in their mouth throughout the day. However, we do recommend that they take it out overnight and actually sleep without the denture in situ, and this just allows the mouth and the soft tissues to rest. Some patients may feel uncomfortable removing their denture at night. This may be due to personal issues, such as their spouse or their partner not being aware that they wear a denture, or that they have a sort of a work routine where they work shifts where they're not always going to be able to sort of have it out for a period of time that's that sort of lengthy. If that's the case, what we want to try and do is encourage that patient to take it out for at least an hour each day. Now, good tips to give is things like if they like to take a bath, that's quite a good time to remove their denture, because they can sort of lock the bathroom door. They have that privacy and that confidence level of privacy. And it's also a substantial time where they might be relaxing, so it might sort of hit that hour's mark. By the time they've sort of ran their bath and sat in their bath and finished, that might be a good time for them to remove their denture. You can also maybe speak to your patient and work out a time where they think that maybe it'd be appropriate for them to remove their denture, just to allow their soft tissues to breathe, and also to just engage and encourage them the reasons why you recommend this and why it's good for them to do it. So when we are removing our denture at night for them to allow their soft tissue to breathe, it's important that they store it safely. So you can actually get little denture baths. I actually got this from the pound shop. So it just has a little pick in it, and we can actually fill this just with clean water, and it just keeps the acrylic that the denture is made of sort of moist and isn't allowing it to dry out or warp. You may be asked, by a patient if they should use cleaning or cleansing denture tablets to store their denture in, and they absolutely can do that. But you just need to advise them that you are going to give them some guidance on how they physically clean their denture, and although these are a good additional method, they shouldn't be used as the only method of cleaning. But if they're taking them out overnight, it is sort of like a suitable way to rest them. They do need to be careful, because some of the instructions will say that there's a maximum time that it should sit in these tablets, so they just want to be aware of that to make themselves aware of it. So how do we clean a denture then, if we're talking about that we have this specific routine? So very similar to, or sort of exactly to, the reason why we physically or mechanically brush our teeth with a toothbrush is that we're wanting to mechanically remove the plaque that has accumulated on the surfaces, and that's the same with the denture. Plaque will have accumulated on the surfaces, and we want to mechanically brush it away. So that's why the denture tablets, although are a good additional method, they're not a good sole method of cleaning a denture, because they don't actually remove the plaque off of the denture, and that's what we're trying to do. So a brush is the best way to do this. You can get little denture brushes that look like this. I'll move it that way, sorry. So you see that you have this part and this smaller part for the hard to reach areas. This again was from the pound shop. Bought this in Poundland. So it is quite a cheap thing or aid to get. Some practices will have little kits that have denture brushes and things like Fixin or Polygrip available that are given out. So you might find in your practice that you can give those out. If they don't have a denture brush or don't have the means to get a denture brush, you can recommend a separate toothbrush. So if they are a partial denture wearer, so where they still have some natural dentition remaining and they're wearing a denture to replace missing dentition, they will already have a toothbrush hopefully, but when they are cleaning their denture, you want to ideally recommend that they have 2 toothbrushes, so one separately for the natural dentition and one for their denture. And the reason for that is because toothpaste is quite abrasive on the acrylic material that the denture is made of, so we don't want to use something that sort of has that residue on it. So for demonstration purposes, I'm going to use my little denture brush that I had. When you're given advice on cleaning a denture, similarly to what I'd said in the oral hygiene aids video, it's very important to demonstrate to the patient if you can, because then that allows them to see the things that you're talking about, and you can also take the time to get them to practice doing it in front of you, so you can identify how their technique is. When we clean a denture, we recommend that a patient does it over a half-filled sink. In a dental surgery, you may have a sink available, or you may opt to use a little basin to demonstrate. So I have my basin here. Now, the reason that we fill it or recommend that you fill your sink with water is because if we were to drop a denture into an empty basin or an empty sink, you can see that that's quite a large bang that you should have heard there, hopefully. And a drop like that onto a hard surface could actually damage or break the denture, so we want to avoid that completely. If we have a half-filled basin, which I just have here, you should be able to hear the difference, hopefully, when I drop it, is that it's not as loud a bang because the water is cushioning the drop, so it doesn't actually hit the bottom of the basin with the same force as it does an empty sink or basin. So that part of it is really important. It's a really important step to advise the patient of, because they might not think of that themselves. So when we are cleaning a denture, we'll have our half-filled sink full of water, or half-filled of water, sorry. For our soap, what we should use is a plain, non-perfumed soap. So we should not recommend the use of toothpastes to clean a denture because they are too abrasive. A very simple, plain, non-perfumed soap is just ideal to clean a denture because it will allow us to get rid of any residue, and it also helps to break down any sort of deposits or accumulated debris that is there. So they can put the plain soap onto their brush, and what they want to do, similar to how we would recommend people to brush their teeth, you want to just make sure that they're cleaning all surfaces in all parts of the denture. Now, this includes the teeth that are on the denture, and it also, very importantly, means the fitting surface, so where the denture sits on the soft tissues or on the gum, all around, all over. So very, very important. And you can just get them to mimic the small circular motions that they would do if they were brushing their natural dentition. As I said, you do have this small end, so you can use that to get into hard to reach places or into smaller grooves within the denture, just to make it a bit easier for them. Okay. Now, it's very important that once they have cleaned all the surfaces of the denture, that they rinse off any of the soapy residue. And it is a personal preference to the patient whether they want to dry the denture before they then put it back into the mouth, or if they just want to put it into the mouth once it's been rinsed. As I said, it is just a patient preference. Some prefer it one way and some prefer it the other. When we are looking at times to brush or clean our denture, if they have natural dentition, they naturally, hopefully, fall into brushing their teeth twice a day. So they would be brushing their teeth and their denture at the same time. So once they brush their teeth, they would then take some time to brush their denture. And they should be removing their denture to brush their teeth. So it shouldn't be a big sort of change to their routine for them to be able to do that. If they have a full denture and no natural dentition, hopefully they would be aware of the twice a day toothbrushing routine that's recommended, or the key oral health message that's recommended. So it is still a very good time to recommend a denture wearer to clean their denture first thing in the morning when they get up, and last thing at night before they go to bed. Even though they're not going to be putting their denture back into their mouth at night time, it still means that they're leaving it there with once they've removed the plaque and the residue, which should be quite a good time for them to do that. Okay, thank you very much. I hope that was helpful, and I'll see you again soon. Thank you.